Hello, I'm Dr. Jessica McCain with Southern Comfort Marijuana Clinic. I'm board certified in family medicine and have been involved in medical cannabis since the passing of Florida's Amendment 2 in 2016. These educational videos are designed to help guide patients in the process of legally accessing and using cannabis specifically for disease treatment and health promotion. These educational videos are designed to help patients in the process of legally accessing and using cannabis specifically for disease treatment and health promotion. In this part of the video titled Marijuana as Medicine, I will showcase cannabis as a valuable herb for a number of medical conditions. In the other videos in the series, we go over the legal setup in Florida and cannabis use recommendations. The endocannabinoid system functions to maintain balance from stress placed on organ systems and controls processes like innervation of organs, memory, appetite, energy balance and metabolism, social behavior and psychiatric patterns, immune defense and inflammation, reproduction, pain sensation, motor coordination, thermoregulation, sleep, etc. The field of medicine that studies the ECS is relatively still new, only discovered in 1993 and barely even mentioned in medical schools. Over the past decade, there has been significant advances in public policy and perspectives of healthcare providers due to growing worldwide appreciation for anecdotal life-changing experiences, the increasing volume of published scientific studies, of which there are about 25,000 mentioning cannabis, and the advances in technology that prove the importance of the cannabinoid system for our health. When you see lists like this, it's reasonable to be skeptical about how one plant can benefit so many diseases and symptoms. The ECS is a very important system and has been maintained through millions of years of evolution in all species except for insects, and the theory is that the disease happens when the balance cannot be maintained, in part because of a deficient endocannabinoid system. Supplementing with cannabis may also be good for health promotion, with chronic users being 1/3 less likely to be obese and have issues of hypertension, high cholesterol, or diabetes. It may lower occurrence of cancer, help with osteoporosis, and prevent dementia. Sports teams are interested in the vasodilatory effects for muscle healing and concussion support, relating to preclinical studies of smaller infarct size in studies of induced stroke and heart attack. Even the U.S. government can appreciate the neuroprotective and antioxidant potential of cannabinoids. Unfortunately, the near century-long ban and still limiting policies curb full understanding of cannabis pharmacology, and clinicians have variable levels of understanding and strategy. It's generally understood that every person will have different dosage needs for their cannabinoid deficiency, so there's no standard protocol or prescription. The THC and CBD we identify in cannabis plants are the human equivalents of anandamide, abbreviated AEA, and 2-arachidonylglycerol, 2-AG. So when these chemicals become low in our bodies, we can replenish with plant versions. And marijuana happens to be a plant of high concentration and extractability of cannabinoids. Since 2003, scientists have built upon the understanding that a clinical endocannabinoid deficiency syndrome, CECD, is likely related to the pathology of many diseases, since AEA and 2-AG regulate many other hormones and neurotransmitters. Some examples include dopamine in Parkinson's, acetylcholine in Alzheimer's disease, with the additional effects to the amyloid plaque buildup, serotonin, norepinephrine, and glutamate implicated in behavioral health, GABA for seizures, cortisol associated with glucose intolerance and Cushing's, and etc. The plant cannabinoids have also been shown to have similar pharmacology to multiple pharmaceutical classes, like COX-2 inhibitors, as are the NSAIDs Celebrex and ibuprofen, and anti-TNF action like biologic medications such as Humira. Neither prescription are truly safe medications. We really also need to accept that our Western lifestyle contributed to this deficiency, with the low intake of fruits and vegetables, but high intake of sugar and processed foods. Both diets are pro-inflammatory. And the lack of exercise, which also limits the positive reinforcement to make new receptors. So healthy lifestyle changes also need to be taken along with cannabis medication. There are hundreds of beneficial chemicals in cannabis, and the two most common cannabinoids we place focus on are cannabidiol, CBD, which is non-intoxicating and in many organ systems throughout your body, and tetrahydrocannabidiol, THC, a psychoactive chemical that can get you high, but also so entwined in the nervous system that it does have significant medical benefit. When used together, the medical benefits are mutually enhancing compared to when using either pure CBD or THC alone. So you'd also use less total dosage when combined blends versus used independently. This is because of a very important phenomenon called entourage effect, and this is the cornerstone concept that you do need both medically and financially. Although it is too much of a simplification, we could consider CBD as a main chemical to target the chemical imbalances, and THC could be used to enhance the perception of symptoms, though both really treat diseases very well. The balance of CBD and THC are further emphasized with this chart. Pay attention to the medical benefits and presence or lack of side effects at different ratios. Generally, for medical purposes, there should not be much reason to go beyond a 1-to-1 for maintenance dosing, and higher THC would likely be more appropriate for breakthrough or for sleep. I hope I'm clear, though, that having a solid amount of CBD and THC is needed for symptom and disease control for most people. This chart can be used as an example of how someone might tailor the ratios or the recipe-like balance of CBD and THC for specific conditions, noting, however, this is not a rule for any person. The mechanism of action is analogous to many pharmaceuticals and can be used to treat near 71 different symptoms and conditions. The most common reasons for use being pain, anxiety, depression, and sleep. CBD is a key component for pain relief, minimizing inflammatory markers targeting arthritis and autoimmune conditions. This lessens joint destruction and swelling that compresses nerves. It is studied for promoting bone health as supporting osteoblast function, which is lost after menopause with the lack of estrogen. Most pain conditions are a combination of inflammatory and neurologic causes, such being fibromyalgia, and the benefit from the combined use of THC is helpful for the sensation of nerve pain. For mental health and neurologic conditions, CBD can elevate serotonin to assist with depression, lower adrenaline for anxieties, elevate GABA to quiet nerves, adenosine for associated IBS symptoms, and lower glutamate to minimize aggression. It also has been shown to balance acetylcholine levels, which can be helpful in dementias as well as organic insomnia due to chemical imbalances. Given that THC receptors are in the nerves, using cannabis can be neuroprotective to toxins to prevent inflammatory or infectious dementias and painful neuropathy, cleanse plaques in Alzheimer's, control spasms in the musculature, including in the GI tract and blood vessels. It also helps to mentally assist in the tolerance of triggers and relaxation, but in excess may cause paranoia. THC is helpful for insomnia too, due to the PSD flashback or nerve pain that prohibits a peaceful rest. Not intending to confuse further, but to clarify an important difference. CBD-A is the raw version, which turns into CBD in the processing stages. Raw cannabis is not psychoactive itself, so CBD-A has no role in mitigating a high. Therefore, a lot of people see the additional medicinal benefit as CBD-A is more dedicated to that function and THC effects are not muted. Therefore, THC dosing is not affected. The understanding of terpenes is a growing interest in the cannabis community and are accredited not only for the aroma of this specific plant, but also for the mind-body effects it provides. They act similar to common essential oils, which are popular in homeopathic treatments. Even baby lotions, often lavender-scented, use terpenes like linalool for the relaxing effects. Myrcene provides a musky lemongrass smell to cannabis plants and is known to be a muscle relaxant and a sedative. Cannabis strains that contain higher levels of myrcene are more likely to cause that couch-locking drowsy effect as it potentiates the THC high. In contrast, plants high in terpenes like pinene, a crisp aroma, may be more energizing and alerting, and this terpene is known for its ability to expand airways and be anti-inflammatory. There are thousands of varieties of marijuana profiles based on the balance of the 400-plus chemicals, including cannabinoids and terpenes. This is what makes up specific marijuana strains, also called cultivars. And here is where the pop culture and science clash in terminology, making it difficult for the consumers. These cultivars or strains are giving trendy names like Blue Dream, Girl Scout Cookies, Pineapple Express, and 9-Pound Hammer. Unfortunately, the terminology conflict is further complicated as strains are in pop culture classified as sativa, indica, or hybrid. Scientifically, these terms were designed for naming species based on a botanist's interest, like the leaf pattern or growing environment. It's like knowing if a cat is a feline and dog is a canine, though not all animals are lap pets, and definitely have different internal nature. Pop culture has inadvertently used the terpene profile to say that those plants that have a majority of relaxing terpenes would be an indica, or if energizing, then a sativa. Cannabis users have made extensive catalogs for these plants, which you can read about their features on websites like leafly.com. Yet there are virtually no safeguards to let consumers know that the strain that they have purchased is in fact the strain they believe they are buying. Strains can be named by any grower blending species. It may be important to note, however, that there could be functional differences if you are using the whole plant or getting extract products, which could obviously change the chemical balance intended. CBD and THC are consistent and can be lab reported, but often terpenes are extracted in the chemical processing and then possibly reintroduced. The extraction method plays into whether the final product is truly full spectrum or an isolate. To transition now to how we use marijuana as medicine, we will teach the terminology you need for your recommendation. First in our discussion is the route or method of intake. The categories are oral, meaning medication you swallow, which includes pills, thick oils, or edibles. Sublingual, meaning dissolvable under the tongue and includes tincture drops or sprays. Inhalation of either oils or the flower. Topical lotions or patches. Suppositories for rectal and vaginal use. Part of your selection is preference, but each route has specific features including the time of onset to start working and duration effects and the difference anticipated mind-body experience. Inhalation methods include smoke, vaporizers, and nasal spray. Vaporizing cannabis is healthier than smoking since it turns cannabis into a mist with hot coils rather than using butane flames, is at a lower degree temperature and therefore doesn't lead to combustion, which introduces carcinogenic tars. Vaporizers can be either flower or extracted oils. Herbal vaporizing of the flower is the best, as the heating element evaporates the plant material, leaving behind a medicine that is full spectrum. The oil vaporizer extracts may be more potent than herbal vaping or smoking due to the concentrating process, but may lose the full spectrum of beneficial chemicals familiar to strains. This method is a great option for breakthrough during a symptom flare-up, as it works the quickest, pretty much immediately, within minutes, and lasts about 2 to 3 hours. Chemicals go straight into the bloodstream, considerably clean and unchanged. You don't lose any medication to the process of GI absorption or the liver's metabolism, so some may find that they need less total volume or milligrams. There is less risk for drug interactions with such route, but the rapid onset of inhalation may be overwhelming. To date, I have read no significant association for vaping cannabis leading to the cause of asthma, COPD, because it doesn't decrease pulmonary function tests, or lung cancer. Some patients may actually benefit from the bronchodilatory effects that some cannabis have, whereas some people may develop a bronchitis-like cough that will resolve when the use stops. Avoid products that expose plastic to heat, and when possible, choose vaporizers that contain no MCTs or fillers that turn toxic when heated. Sublingual is a category that includes drops, often called tinctures, oral spray, or lozenges. This is also the preferred method whereby the medication is absorbed into the bloodstream via sub meaning under and lingual meaning tongue route. It is the healthiest way to take cannabis, especially for people with existing lung or heart conditions. These drops can be used for breakthrough with relatively quick onset, 30-45 minutes, but more so for maintenance, with treatment effects lasting up to 6 hours. Sublingual drops should be thinner, taste pleasant, have specific action times. All these characteristics are noticeably different compared to ingested or oils that need to be swallowed. Question the pharmacist if you have any doubt about your purchase. Liquid cannabis can be cooked with, make lotions, and homemade suppositories or salve. You are not limited by your creativity, but be aware of the different mind-body effects that the same extract can have in different routes. The oral category includes capsules, oils, and edibles. In general, these have a slower onset of up to 2 hours before a noticeable effect, and those may last up to 12 hours, so really only for maintenance use. This route is not ideal for the THC beginner because the effect may be less predictable, as once it hits the liver, it changes from 9-delta THC to 11-delta THC, which is more psychedelic or an intoxicating chemical, meaning the greater risk for unpleasant side effects. Now, if the raw plant extract is ingested, the form of chemical is THCA, and that has minimal psychotropic effects because it hasn't been heated or decarboxylated. Some will find that they need higher milligrams to achieve the effect because of the metabolic breakdown in the GI and liver tract. Also, if you do not have a well-functioning gallbladder, it may limit cannabis absorption. For extra safety, if you take high dosages, then have your physician monitor your liver function labs when initiating this method. Topicals include lotions and patches. CBD penetrates the skin better than THC, good for targeting arthritic areas where the skin is thin, like in your feet, ankles, knees, elbows, hands, and neck. It has been used for skin conditions like psoriasis, atopic dermatitis, or eczema, healing from cancer or burns, and cannabinoids also have anti-MRSA and antifungal properties. THC can be helpful in topical preparations for nerve-damaged areas, such as from shingles or restless leg syndrome. Suppositories are used both rectally and vaginally. Both CBD and THC have been deemed beneficial for treatment of colitis, proctitis, postmenopausal changes in dyspareunia, and even conditions like interstitial cystitis with its local absorption. There is variable data if this method can lead to high enough levels in the bloodstream for systemic disease, but consensus is that this route has been shown to have minimal psychotropic effects and is useful if no other route is possible. Benefits can be noticed between 10 to 15 minutes and may last up to 8 hours. Medscape, which is a very popular database for all medication information, has a drug interaction checker. Clinically significant interactions will be more likely at higher doses of cannabis, with oral routes of intake, inconsistent use, or maybe when using the whole plant versus extract. Since cannabis hasn't been studied with all pharmaceuticals, often this is theoretical. With this herb having the mechanism of action very similar to many prescriptions, you may find that you need to adjust the dose of those. Listen to your body and continue with your routine lab work and guidance from your other prescribing providers. If it's your goal to come off of the medications, do so under their supervision, but we would suggest initiating with cannabis first and then after 2 weeks cut back by 50%. A specific opioid protocol is introduced in the next video series. Some medication-specific suggestions are as follows. Some seizure and cholesterol medications may actually become stronger, so monitor liver function when initiating. Avoid the simultaneous use of triptan migraine medications. Insulin might need to be reduced. Check INRs more frequently as Coumadin dose may need to be decreased. Blood pressure and heart rate are initially labile, but with consistent use, both will lower, so monitor your vitals before and after dosing until this levels out, and pay particular attention if you take beta blocker prescriptions. Also monitor yourself if you take heart rhythm medications, which by themselves have a very narrow therapeutic window. Avoid taking stimulants like coffee, amphetamines like ADHD medications, or cocaine at the same time. Taking medications at the same time as pharmaceuticals that are sedating or slow cognition, such as benzodiazepine, barbiturates, some mood stabilizers, and anti-seizure medicines need to be used with care. There is a good safety profile for the use of opioids and cannabis together. Alcohol should be avoided as it can enhance the THC psychoactive effects. I can't emphasize enough how this medication is very individualized, and this will be a personal, safe experiment if taken slowly and as directed. Some of the listed side effects happen to be the same symptoms that other patients use to treat cannabis. It goes back to finding that balance in the cannabinoids, noting that more is not better, and strategies to minimize side effects will be explained in the next video. Unpleasant events can last between 4 to 24 hours depending on method of use. It seems to happen more frequently with ingestible options like infused foods or capsules due to the THC becoming more psychotropic. Overdose will not cause long-term organ damage or death. The American Medical Association reports that the most common side effects are dizziness, dry mouth, nausea, vomiting, diarrhea, fatigue, sleepiness, euphoria, which is excitement and happiness, depression, anxiety, disorientation, confusion, impaired balance, hallucination, and paranoia. Patients also reported impaired short-term memory, but without significant reports of long-term impairment, having tested recall is restored after a month of discontinued use. Cannabis doesn't necessarily cause psychotic disease, but can bring about a previously hidden condition. A recommendation to not use cannabis may be given if there is a family history of psychosis, meaning a person who hallucinates, has delusions or disturbed thought, or lack of self-awareness. The same would be said for any patient with poor control or recent relapse in their mental or behavioral health. Extra caution is advised for patients under 25 years old, still undergoing brain development. All users with psychiatric issues should focus on CBD as their backbone compound to avoid psychoactive effects as well as microdose. Cannabis hyperemesis syndrome is a condition in which patients who are typically using high concentrated cannabis products consistently or daily for more than 3 months may experience cyclical nausea, vomiting, and abdominal pain after using cannabis, and uniquely feel that frequent hot showers alleviate symptoms. This syndrome is typically resolved after a patient discontinues cannabis for greater than a month or reduces doses significantly. But overall, cannabis is non-toxic and non-lethal. Scientists have literally been unable to kill animals with mega-high doses. But it should be appreciated that any compound introduced into our bodies will have consequence. There is mixed data about cirrhosis in the use of marijuana, with the current belief that in early stages, CBD is antifibrotic and hepatoprotective, but THC, especially in later stages, can advance scarring or cirrhosis. There are no cannabinoid receptors in the brainstem that control lung or heart rate, so it would be extremely rare to have cardiorespiratory arrest because of cannabis. However, reconsideration of use is advised for patients with unstable cardiac disease or congenital heart defects. Patients should avoid driving or operating other machinery or ammunitions while using cannabis. Everyone should be confident in interpreting their body's response, especially if they are using THC. This is the same advice for any pharmaceutical. Unlike alcohol, people using cannabis are usually aware of their impairment and able to use their sound judgment. Even the DEA acknowledges the deaths associated with cannabis have been the result of accidental fatalities, so be responsible and careful with your use, as you would with any medication. Statistics are that an estimated 9% of illicit or recreational cannabis users become dependent. This is similar to the addiction of caffeine, compared to 15% of alcohol users or 32% of nicotine users. Dependency means the possibility of withdrawal symptoms, which can include anger or aggression, decreased appetite, anxiety or restlessness, or sleep difficulties and strange dreams. These symptoms emerge around 3 days after cannabis cessation and resolves in about a week or two. We'd recommend you seek medical advice for help if your cannabis use impairs your social or occupational obligations, especially if it is leading to the point of impaired thinking or mood or muscle coordination disrupting your functioning. Cannabis reduces harm for many as an exit drug rather than a gateway for other drugs. I'd like to finish this series by referring you to several resources for additional information. Check out our clinic's website at www.socommjclinic.com for a lot of answers to FAQs, but also a database for other links for resources. Our SoCo YouTube channel has our clinic's educational videos, along with our playlist, which has a collection of videos from various sources like Dr. Sulak, Greenflower Media, Mara Gordon, Dr. Sanjay Gupta, and more. Unfortunately, YouTube policies have led to the removal of a lot of videos related to marijuana and cannabis. If you get excited about learning more on all facets of cannabis, check out Greenflower Media, which has very entertaining and educational articles and videos hosting roundtable discussions with cannabis specialists in various fields. Dr. Sulak is an admirable cannabis physician with vast clinical experience, and I highly recommend you reviewing his website, healer.com. This website is free and provides access to recorded video programs which you can use during your experiment to help with dosing, suggestions to avoid side effects, strategies for cost, diet tips, and more. He is research-oriented and cites references. The articles are written simply so you can read them and understand them well enough to explain the science to someone else who may benefit from cannabis. Please continue to the next video in the series provided by Southern Comfort Marijuana Clinic, where we discuss your treatment plan. Thank you for watching the educational series, which allows us to spend more time taking your education to the next level when we are in our office visits. Our contact information is the phone number 772-218-7262 and email at support@socommjclinic.com. When leaving a message, please include the details of your question, your phone number, and email address, since we often respond after hours. But please allow up to 48 hours for response. Thank you for allowing us to be part of your healthcare team.